Member from Memramcook-Tantramar.
Thank you, Madam Speaker. I'm rising today to respond to this throne speech, but first of all, I would like to start by acknowledging that we are here on the unceded, the unceded and unsurrendered territory of the Wolastoqey people, and New Brunswick is made up of unsurrendered and unceded territory of the Mi'kmaq, Wolastoqey, and Passamaquoddy people. And that is something that every New Brunswicker should be well aware of and understand, and that we are all treaty people. Treaties that were signed in the 1700s, the peace and friendship treaties, did not involve a surrender of land and rights. And so it's important to start by acknowledging that as I start my response to the speech from the throne. So I heard my colleague here, MLA for Fredericton-South, leader of the Green Party, il a dit le discours du trône c'est vide. Il y avait presque rien là. Il y avait seulement quelques idées qui étaient nouvelles, mais pas beaucoup. Et les idées qui étaient là, ben, j'ai beaucoup d'inquiétudes à propos de ces idées. Je vais parler de beaucoup de différentes choses et honnêtement, je pense que nous pouvons offrir une vision de ce qu'on pourrait faire pour le Nouveau-Brunswick parce qu'il n'y avait pas vraiment une vision dans ce discours du trône. So I found that there weren't new ideas, and the new ideas that were there were troubling. A speech from the throne is supposed to lay out the government's vision for what they're going to do, and a lot of it was looking in the rearview mirror at perceived successes and things that have been done. I want to start by looking at the issue of poverty and of affordability. So many people in New Brunswick are being touched by this issue. So many people are struggling to make ends meet. I know that this issue is a long-standing one. It's not like just during the pandemic and with inflation, suddenly there are people who can't make ends meet. This has been a significant issue in New Brunswick for a long time, with child poverty rates over 20%, if you look at averages, in some areas much higher, much higher. I think of places, St. John, I believe Campbellton, there's different parts of the province where it's even higher. And it's terrible that we have basically at least 1 in 5 children living in poverty. And it's not just about the children, it's terrible for them to start off living in poverty. This is happening to many seniors. It's happening to many people of all ages and backgrounds. There are definitely certain socioeconomic factors that impact certain people more, but we have an issue, and it's something that we are not addressing. And then we wonder why we have issues around food security and therefore chronic health issues. If we ignore the social determinants of health, Madam Speaker, then we are doomed to have certain issues within our population's health. And so we must invest in living wages and in social assistance rates that are give people some dignity. Frankly, we need a guaranteed livable income, Madam Speaker. The research is there to show that that is the path we should take. Yes, there are details to be figured out, but that is the path that we need to go down, Madam Speaker, because it is unacceptable that people don't know where their next meal is coming from, that they can't afford transportation to get to their health care appointments, that They can't afford to buy their medication and to pay their power bill, that they can't afford their rent. Madam Speaker, there are things that the people elected to be MLAs who are in this room here could do to help with all of those things. It's a choice not to help with those things. And unfortunately, that's the choice that keeps being made over and over with successive governments over the long term. And then we see the results. We see the results in terms of, it was a while ago now, but there was an abandonment of public housing. There has been neglect towards recruitment and retention of healthcare workers and of teachers. There was an abandonment of Efficiency New Brunswick. We're trying to play catch up now with trying to get energy efficiency ramped up, and we're nowhere near the investment required to help people not only save on their power bills, but reduce their emissions. There are so many major issues that over the years it's accumulated, and now we are facing multiple crises on multiple fronts, Madam Speaker. I want to continue there talking about health care. This issue impacts everyone, and I see it in my community, the different ways that the lack of access to health care is playing out. One thing that I have noticed since the Higgs government threatened to close the ER in Sackville overnight and to get rid of acute care beds, is there's a level of stress with the whole population. Will the hospital be open when I need it? And sometimes it's not, Madam Speaker. Sometimes it's not. Whether it's a severe emergency and someone needs to go there, or even just trying to, like they have a cut or a broken bone, something that needs stitches or an x-ray. Showing up, it's 4 p.m., sorry, go home. Madam Speaker, it is so stressful, and there are people who I know have actually moved out of the community because it was too stressful for them to live somewhere where they didn't know if they'd be able to get the health care they needed. And so that's talking about emergency health care. And we also know that people in rural communities across the province, but in my riding, I think of Port Elgin, some of the worst response times for ambulances. It's terrifying. It's that stress that's always there. What if I need an ambulance? What if I need a paramedic? What if I need to take my kid to the ER? Will it be there? And so in terms of emergency care, there are major barriers. I know people are waiting days to see doctors. They're showing up in the ER, maybe waiting over a day. If the paramedic takes them, they may need to wait there. They're doing shift changes. The hospitals in Moncton. And so that's acute care, that's emergency care. Primary care is a major issue. And yes, there are some demographic issues at play here, but there's also just bad policy at play. There's also just governments moving too slow to implement team-based clinics, because there are doctors who have left their practices because it wasn't manageable. The model for the family physician wasn't working for them. They asked for help, they asked for changes, they didn't get it, and so they've left their practice. And there are nurses who've asked for things, other healthcare professionals. They're the ones working in the system, and we need to listen to patients, but we need to listen to healthcare professionals. They're working in these systems. We need healthcare clinics, multidisciplinary, team-based healthcare clinics across the province. This model needs to be offered to healthcare practitioners. All the ones that I'm talking to, that's what they really would like, to have that model. And what that would mean is that people in my community and communities across the province would have access to primary care. But unfortunately, things are moving too slowly. And we've seen doctors retire, doctors leave. Again, we could see this coming. We know that many doctors are going to be retiring in the coming years. What are we going to do to make sure people have access to health care? this goes back to the social determinants of health and goes back to preventative health care. Without a doctor, without someone to like order tests to go see before things get serious, how can we have that preventative health care? How can we look upstream and prevent worse health outcomes, which also do cost the system more? The priority is obviously people's health, but we're causing our healthcare system to be more expensive by not taking care of people sooner. And there are so many cases where people they don't have a family doctor, so they can't access the health care they need. Maybe it's mental health care that they need, and they need a family doctor to fill out the form. And then the department's saying, well, send them to their family doctor. And we're saying, but there isn't one. So, Madam Speaker, what are people to do? What are people to do? They need blood work. They know they need blood work. They try going on e-visit. That doesn't work out. A lot of people, and this is a major issue that keeps coming up, a lot of people don't have access to a computer or internet, or may not have the technological literacy to navigate that. Texting, and sometimes the appointments are just like texting, that's not the way that everyone can communicate, Madam Speaker. And so this is not accessible for a lot of people. Transportation keeps coming up as well. When we talk about healthcare, there are people who can't afford to get to their appointments. They don't have a family doctor in my community. They're being told, oh, you can have an appointment in Moncton or Dieppe. How did they get there, Madam Speaker? I know someone who was wondering how they were going to get to the hospital to give birth. Yeah, that's a major challenge if you don't have transportation. There are some major issues, and there's just been, there's a lack of will to invest in the healthcare system and in the transportation system that we need. We need people to be able to move around the province, north and south, and between the cities and within the regions and rural areas. We can't forget that rural people need access to transportation as well. What is that going to look like, Madam Speaker? So far, there's not much there, and what it means is poor health care for folks in my community. And then we can talk about mental health and addictions. And when we talk about addictions, we need to remember this is a medical condition of disordered substance use. And we tend to criminalize addictions. Sometimes we criminalize mental health. We need mental health courts to be available across the province. That is not the case. But I'm really disturbed to hear some of the ideas coming from the Higgs government on this issue around the so-called Compassionate Intervention Act. Madam Speaker, I will send this later to the minister, but there's actually a recent report entitled Mental Health, Human Rights and Legislation, Guide and Practice, and it's by the World Health Organization and the United Nations UNHR, Human Rights. And they are talking about eliminating the use of coercion, respecting legal capacity, eliminating use of coercion, and it is terrifying to think of bringing in legislation to force people into treatment. That violates human rights. That is not the best practice, and there's evidence that that can actually cause more harm. And so it is unacceptable that the data is obviously not being looked at, the best practices are not being looked at, and I really hope that this doesn't go forward. But that's one of the only new ideas that the Higgs government is putting forward in the throne speech, and it's terrifying. I can tell you the Greens would not do this. The Greens would not be coercing people into treatment. What is needed is housing, is a stable income, is different wraparound services for certain people. It's actually access to mental health care. I've been trying with different constituents and people from different parts of the province who contact me to get people into detox or rehab or get mental health care, to get them to see a psychiatrist. I've helped advocate and helped them navigate. It's really hard. So let's deal with that. That's what needs to be done. We actually just need to make sure that mental health care is accessible. Leave this coercion stuff behind. It is unacceptable, and so I will send this evidence. Don't know if anyone will listen, but I'll send this evidence to the Minister of Public Safety. I do find it interesting it's not the Minister of Health or the Minister of Mental Health and Addictions who are bringing this forward. I'm very concerned about this. And so speaking of housing, Madam Speaker, things are really desperate for a lot of people. There are a lot of people who aren't sure they're going to be able to pay their rent. They're worried about paying their mortgage. And then there are people who have been priced out of their apartment. It was previously affordable. We've actually lost thousands and thousands of affordable units. They're no longer affordable in New Brunswick over the past several years. There are policy tools we could use to stop this from happening. So not only do we need to protect tenants from unreasonable rent hikes, but we need to protect the housing stock that's still affordable in this province, Madam Speaker. And I can tell you a Green-led minority government would bring in a rent cap immediately. I can tell you, Madam Speaker, that this is something we've been fighting for a long time. We've tabled bills advocating for tenants, advocating for a rent cap, and people have lost their housing because the government has failed to bring in good policy on this, Madam Speaker. They've lost their housing. It's too late now, but there are people we could still protect. And so I once again call for there to be a rent cap, and I call for the government to make sure there's proper investment and financing in nonprofit and cooperative housing projects. There are people who are willing to roll up their sleeves and do this, but my goodness, it's hard to navigate, it's hard to get the financing, it's hard to get that capital investment up front, and it's frustrating, Madam Speaker. Especially many of these people who are willing to do this are volunteer board members, and they're doing their best, but we need to improve the system. Madam Speaker, there are so many things we need to do. I've been calling for a rent bank. We're waiting on the rent bank. I can't wait for that to actually come into place and to see what regulations, what they've set up exactly, because we need to ensure that it works for tenants. Madam Speaker, I've mentioned today already my concerns around transportation and infrastructure. So I'm concerned that we have not maintained the public housing that exists, have not built enough, and we need the government to build more public housing. And then I'm concerned on the other side, the non-social development side of infrastructure, that we are not maintaining the infrastructure in the province. I think of the schools across the province. I know there's a lot of talk about overcrowding. Some of the schools in my area, actually, one of the major issues is that they're old. They don't have proper ventilation systems. And we were told, like Marshview and Dorchester, we were told that they would get new ventilation systems this summer, and they did not. And we've been going through a pandemic where an airborne virus has been going around, and we still don't have proper ventilation in the schools or in the nursing homes. Like, it boggles the mind to think that we could not seize the opportunity to improve air quality. There's actually studies. It's not just about COVID. That's an important piece of this, but and other airborne viruses. But there's actually studies that show better outcomes in education, when you have cleaner air. Our society sometimes forgets that that we're part of the environment, and I certainly think the Higgs government forgets that we're part of the environment and how it affects us. Look at Coastal Shell. Look at the AIM, the fire in St. John. Look at the weak air quality standards we have indoors and outdoors, frankly. It was a long time ago, actually. There were calls for the government to set up monitoring stations all around the province to take a look at air quality, because there are cancer hotspots in the province, Madam Speaker. We need to take these things seriously. And so we look at the schools, deferred maintenance. There's a whole AG report on it. And then when I think of infrastructure, really critical infrastructure, I think of the Chignecto Isthmus. And I think of how before I was even on town council or elected to represent the people of Memramcook-Tantramar, I was working on this issue, and before I even started working on the Chignecto Isthmus issue, there were people in my community doing research, calling on governments, please, we're going to have catastrophic flooding. And we talk about the transportation corridor, and there's fighting over who should pay for it. But that transportation corridor, there are people that live there, Madam Speaker. I live there. Thousands of people live there, and on the Nova Scotia side as well. So we're not just talking about a highway flooding. I invite anyone here, and I've invited the minister as well of DTI to come and take a look at what we're talking about. Because what we're talking about is full communities that could be inundated. And we know it can happen. Look at Abbotsford, British Columbia. Their levees broke, their dikes broke. Look at New Orleans. The UN actually identified the Chignecto Isthmus as the second most vulnerable place in North America in terms of flooding after New Orleans, and we know what happened in New Orleans. Not crying wolf over here. I'm terrified that any year the perfect storm will come and the wind will be blowing the right way, and who knows, it'll be a certain type of high tide, and there'll be a storm surge, and the dikes will give way. And there'll be that brown, fundy water coming into my community. And so there are lives at risk, Madam Speaker. Not just properties, not just farmland. Lives are at risk. So we need action on this. We need work to start on this. And sure, go to court on this if you want, but don't stop working on this. We need actual funding to be allocated. This is serious, and government after government has dragged their heels, and we're at the beginning of just like a 10-year process to even get this done. Any of those years, there could be a disaster. And if you're worried about money, let me tell you, it will be some expensive to clean up after the Chignecto Isthmus if the dikes were to breach. Madam Speaker, that brings me to the issue of climate change, which was barely on the radar here. It's just the same few things repeated over and over, putting money into the climate change fund. I mean, I don't know, like most people aren't going to go look. Maybe that sounds good. Some years it's like to put GPS on DTI's plows. Like, sure, maybe that needs to be done. I would argue it should be in the DTI budget, but that's not moving the needle on where we need to go in terms of adaptation, protecting our coasts. A lot of my riding, so one side it's dikes, on the other side it's on the Northumberland Strait, and then you keep going up all the way up to Caracat and beyond. L'érosion côtière, erosion on the coast, it's impacting so many people. Where's the plan? What are we going to do? Do we have a climate risk assessment yet? No, Madam Speaker. I think it might have started, but Madam Speaker, how can we even make a plan without this risk assessment? Again, just dragging heels on these really important issues. And when we look at what needs to be done, there is the adaptation side. What are we going to do when it's too hot for people to work outside in the summer, which is already happening sometimes? What are we going to do when there's a drought in terms of farming? What's going to happen? And then actually the drought goes away, and then it's too wet for the farmers to plant. That happened this year, Madam Speaker. There are farmers who abandoned crops. There are farmers who have just abandoned their farm. They've given up this year. It's too hard. They haven't had the support they've needed. We see that we're losing farms, we're losing farmers. What are we going to eat, Madam Speaker? We saw how fragile our supply chains are. We need to be investing in local food, and exports are important, but I want to hear how we're going to feed New Brunswickers. We need a plan to feed New Brunswickers. And so far, the goals that I've seen are not ambitious enough for the amount of food that we're producing for ourselves. It's too low, Madam Speaker, and we need to see investments on that. When I look at what's happening in the arts sector in terms of culture and arts, I mean, that is, I talk about people making sure people have something to eat and somewhere to live and have access to health care, have their basic needs met. We need to be doing that. I can't believe that we're not doing that. And then on top of the surviving, there's the thriving, there's the joy in life, there are the things that happen in our community. And almost every day, multiple times a day, people stand up in this house and congratulate others. And it's often artists. Just today, I was congratulating Freya Milliken. There are different people in our communities who contribute so much through different forms of art. And wouldn't it be great if they had a status as an artist, Madam Speaker? And wouldn't it be great if they had the adequate funding in the arts sector? Because, Madam Speaker, there wasn't good funding before the pandemic, and let me tell you, they did not get the support they needed during the pandemic either. And we need to respect artists, those who contribute to the culture of New Brunswick. Madam Speaker, je vais parler, I want to talk about respect. Je vais parler du respect. Et peut-être je devrais dire, je vais parler du manque de respect envers plusieurs groupes dans la province. Pas seulement les artistes, mais plus sérieusement les gens francophones et acadiens, les Premières Nations et les gens de la communauté LGBTQ+. Il y a beaucoup de gens qui se sentent qu'il y a un manque de respect, et je suis d'accord avec eux. Le gouvernement Higgs a démontré, temps après temps, ce manque de respect. Et on ne peut pas avoir un gouvernement qui n'a pas le respect pour tous ces citoyens et citoyennes. Ce n'est pas acceptable. We've seen a lack of respect towards First Nations, towards Francophone and Acadian people, towards people in the LGBTQ+ community, towards teachers, towards healthcare workers. The list could go on, Madam Speaker. We can't have government that shows such disrespect for so many people. We need things like a retention bonus for nurses. We need the Premier to apologize for having said that teachers were teaching students to lie to them. We need to have an Indigenous-led independent inquiry into systemic racism in the policing and justice systems, and frankly, other systems as well. We need to actually listen to Francophones and Acadians when it comes to la révision de la loi sur les langues officielles. C'était une opportunité que le Premier ministre n'a pas pris. There are so many people who have contacted me and said, you know, they're embarrassed by the way that different people are being treated in in our province. And what's even worse than just not being respected, but being harmed by the rhetoric that this government has been using to talk about certain groups of people. And it's very unfortunate that that trans and non-binary youth have become the target and the talking point. And I stand in solidarity with everyone in the LGBTQ+ community, and we need to ensure that we actually have policies that support them, and we need to ensure that we go beyond just making our schools inclusive and safe, which is absolutely essential. We need to look at what's needed in other areas of their lives, because there's higher likelihood of experiencing violence if you're in the LGBTQ+ community, of being unhoused, of not having the proper access to health care. And I'm not just talking about gender-affirming health care, I'm just talking about actual, like, how people get treated in the healthcare system. But we do need access to gender-affirming health care. And this is something that I've been calling for. And so this is what Greens would do. We would make sure that there's actually access to health care for everyone who needs it. Madam Speaker, if we look at the state of our forests, there are major concerns. So many people contact me about spraying glyphosate on our province. It's spraying glyphosate and other herbicides on Crown lands is an unacceptable way to be so-called managing these lands, these forests. And I'm really concerned with the state of the forest, this report that's come out, this plan that the government is putting forward. If you look in it, it's talking about the plan being to have up to 25% of these forests be plantations. Madam Speaker, that's alarming. That's unacceptable. Our forests, yes, they can be used. They should be co-managed with First Nations. They should be forests that are managed by First Nations and by our communities. There is wealth there that should be spread out and not hoarded by a handful of people. But we have to understand that our forests are ecosystems. We have issues with biodiversity. This is a global issue, but it's showing up here too, Madam Speaker. We need to understand that we depend on these ecosystems. We depend on our forests. We can't have clear cutting. We can't be managing them with herbicides. This is unacceptable. And so we absolutely need to stop that type of forestry. There is a different way to do it, and there are people who know how to, including Indigenous leaders, and we need to listen to them. Madam Speaker, I talked a bit about schools in terms of infrastructure. I also want to talk about the lack of a plan to recruit and retain teachers. Les éducateurs, les éducatrices travaillent tellement fort pour appuyer les étudiants de la province, mais ils se sentent vraiment frustrés, comme il y a un manque de respect et qu'ils n'ont pas les ressources qu'il faut pour appuyer leurs étudiants, pour faire leur job. Teachers, we talk a lot about home care, we talk a lot about nurses, in terms of an HR issue, people burning out. I see this happening with teachers, them leaving their profession because they're wearing so many hats and they're not being supported. They're not being given what they needed. And we see this in a lot of caring professions. We're burning people out. And it's unacceptable. We need to do better in terms of recruitment, and especially in terms of retention. We're dropping the ball on retention with a lot of these workers, Madam Speaker. And I think of in the schools, and I think of in long-term care. I think of whether it's home care workers, whether it's in special care homes or nursing homes. The workers there also facing burnout, having gone through and still going through hopefully just the tail end of a pandemic, but it seems like it's with us for now, Madam Speaker. And they are not able to offer the support that they want to. There's not the care hours allocated that they would like to give to the people who live there. They are facing major challenges. And I think of daycare workers, and my colleague from Kent North earlier today was talking about their wages. That their wages are unacceptably low, and when you compare them to what EAs are getting paid, which I'm glad EAs are getting paid well, but how can they compete with childcare? How can the childcare centers compete? And they can't. And so we need more childcare spaces. This is a major issue all across the province, and it's actually keeping some people out of the workforce because they don't have access to childcare. But we need to support our childcare centers, our childcare workers, in order to support our children. Madam Speaker, I also am just, it's so frustrating to see what this government has done, and they're not proposing much here, frankly, but they're proposing things that I'm very concerned about, whether that be fracking, that's still on the table. I'm very concerned about the millions of dollars that continue to be invested in small modular nuclear reactors, which we had hearings recently, and we know that the safe bet, the best bet is for us to be investing more in wind and in solar, and they kept calling, the experts we were hearing from kept calling SMRs like a wild card, that's risky. And so in terms of an economic investment, in terms of that, doesn't make sense. This isn't Dragon's Den for NB Power and for the government. We need to be making sound investments with New Brunswickers' dollars. And we know the best investments are solar, wind, and battery storage and other types of storage. We need to transform our system, and we're not there. We're not going fast enough. And in terms of energy efficiency, we certainly have a long way to go, and we need to make sure that we're not leaving people behind, that they're able to access what they need for energy efficiency. This must include renters, and for those who are maybe in the moderate income category, that they have access to loans that are zero interest, that we're supporting people, because so many of the programs have required upfront capital costs that would just break the bank, and they can't wait a year or two to get reimbursed. And so, Madam Speaker, I've covered quite a few different topics here, and laying out what is needed for this province, and unfortunately not seeing those things in this throne speech. And so we have seen the centralization of power continue. It didn't start with the Higgs government, but it certainly has been exacerbated by the Higgs government. The centralization of decision-making, the centralization of power, and not listening to the data and what's needed, not looking at the best practices and doing that. And so, Madam Speaker, I have major concerns. I don't see the vision that New Brunswickers need, and I won't be able to support this throne speech. Thank you, Madam Speaker.